Welcome everybody to another VITA Academy of Learning. So today we are going to have Mr. Peter Peasy speak. Peter's always excellent. That is giving everyone a plethora of information, of education, of training, real show it, how you do it. So we are going to have a good time today for the next hour. If you do have any questions, go ahead and just type those questions in. And before we get going, just a couple of house cleaning items. So the phones are on mute. Everyone's phone is on mute. And so there is a question box down on the panel, down at the bottom, towards the bottom. So please use that box to submit your questions. We will do a Q&A at the end of the program as well. We are going to record the workshop. So if, you know, those of you that are on it, or if you want to go visit it later, you can go to VITA North America YouTube channel. Give us a couple of days. We'll post it, but it will be available on our website as well for you to go through it and learn more. So Peter Peasy, today we're talking about the Zirconia black hole effect, bringing fluorescence to the surface, which is a broader topic than just that, right? I mean, it's hard, Peter, to just do one specific topic, but it's a title, right? So thank you very much for joining us today, Peter. Appreciate it. You look dazzling in your orange smock. I like that. That's a cool color.
We got to switch it up now and then.
Yeah, it's a little bit better than the gray or blue, you know, a little bit more color. So that's nice. So I'm going to introduce Peter, and then we'll get going. Peter Peasy, CDT, MDT, worldwide dental educator for technicians, dentists, and auxiliaries. Owner and manager of Peasy Dental Studio in Staten Island, New York. Has a personal appreciation and expertise on all phases of clinical, laboratory, traditional, digital techniques, color communication, and digital photography. Peter's rounded technology understanding is well balanced, and that's why he does such great presentations, because he can fluidly go from one area to the next area and talk about it with his experience, which is very nice. So he is a board member of the Association of Master Dental Technicians, teacher educator at the Master Dental Technician program at New York University, facility member of NYU School of Dentistry, member of the American Academy of Aesthetic Dentistry. He's executive board member and fellow of the Northeastern Nathological Society, editor-in-chief for Inside Dental Technology, and for the ACP Technician of the Year in 2018. So Peter, welcome. Appreciate it.
Good morning. It's a long list there.
Yeah. So got to give where credit's due, right? I mean, you got a history of well known in the industry. So.
Well, thank you. I appreciate it, and welcome back. This is our first of the year, and we're getting ready for Chicago. So I guess let's get rolling. If that's okay with you.
Sure. Yep. So I'm going to make you the presenter.
And I think you should be good there, Jim.
Yep.
You see everything okay?
We are good.
Just get this out of my way a little bit. And okay, great. Well, thank you, and welcome back. It's I feel like it's been a while since we did our last one. And yes, the topics really a lot of times Jim is picking them based off feedback from you guys. So this was Jim's topic, and I think Jim does it too to make it harder for me, because he wants me to try to figure out what he's trying to get to. So it's actually fun and it's challenging. But for those of you who know me, I kind of go back and look at what I did the last time I talked about the Zirconia black hole, and I don't want to do the same thing over and over again. So I'm always looking for something new and a different way to talk about it. So I think this is a challenge that we faced. I think it's kind of evolved over the years, and I would say it's probably we have a better understanding of it today than we actually did years ago. when you look at nature under fluorescent lighting, which seem to be a huge relevance to us to really create nature in all environments. And what we mean by that is, are people walking around under black light? Of course not. But some people are, and some people work in club environments, and some people want the teeth just to look natural, whether they're in the daylight or the nighttime or in a club or having dinner or out on the beach, right? You want that metamerism type effect where your teeth just look real all the time. And that's really challenging to do with each material, and each material has presented its own issue for that. So for us, there's really three keys to making those things work. And fluorescence is probably the number one for me, but there's also translucencies and opalescences. And although I won't really focus on the translucency and opals today, I'll stick to the real fluorescence part of it, but we can really talk about what we've done and how it's evolved so much over the years. And let's be realistic, where this really matters most is when we're matching maybe one tooth. And this is an implant crown, obviously from a long time ago. But I was going back in my old cases and kind of looking through the development of fluorescence and my understanding of how to use fluorescence and how to incorporate the right amount of translucency and opal and all the things that we would normally do to make something look real. And it's been a fun evolution, a difficult evolution, I must admit. And in today, I would argue that I don't think I've worked it all out perfectly. I think we're still kind of playing and tweaking. Part of that is our brain, right? We evolve and we start to think a little bit differently, but also part of it is the materials that evolve. And I think the materials, especially zirconia itself, and let's be clear, fluorescence, opalescence, all those things isn't limited to zirconia, right? We have the same challenge with every material that we use. And I don't care if that's metal ceramic, which I still use a lot of, if it's lithium disilicate, zirconia, even some of the more hybrid type materials, and definitely in nature when I'm using just pure feldspathic materials. Incorporating those events happens across the board. So to make it sound like it's just for zirconia, probably not the right way to say it. But when we look at nature, and I think you can see here kind of what I'm talking about, look at the fluorescence of the lower teeth, and look at the fluorescence here in the lateral, and when the teeth are prepped, how much more fluorescence they appear to be. And that's because obviously we're closer to the internal surface and that dentin. And that area we've managed over the years this way. For me, it started probably 15, 20 years ago, and understanding how to use metal ceramics and create some sort of fluorescence in them to recreate what nature has done. And I was using nature as the example. I was spending a lot of time in a closet with black lights and my camera settings turned down to crazy numbers to try to really capture the fluorescence of nature. And it wasn't easy. A little easier today with the technology and the camera, but for me, it all started here. It was really about understanding how to get more fluorescence into the tooth and into the crown and bridge that we were doing. As it evolved and zirconia came on board, and let me just be clear about the metal ceramic before I jump too far. The good and bad of metal ceramic was, like every material, there were pros to it and there were cons to it. Was it the most aesthetic material? Probably not. Did we make it to be one of the most aesthetic materials? Definitely. I would still argue that I can probably make a PFM look as good as almost any material out there today, or metal ceramic. But that's based off years of practicing and trying and changing the concepts of fluorescence and opacity. The two keys to it, though, were we used margin materials like I showed you here, and the margin materials allowed us to get a little more fluorescence up into the gum tissue and around the root, and that really made the lighting capabilities of the root, the tooth, and the pink gingival work together. And the other key was the opaques. The opaques actually have a small amount of fluorescence in them, and that gives us a basis for a little bit of a fluorescence in the final restoration. So over an ideal or over a period of time, this really worked well. Around the late 2006, 7, 8, I guess, is when zirconia really started making its big push. And at this point, I think I'd say we were really clueless about what to do and what to change with it. And I could tell you the first goal of it was just to make the zirconia coping, which had none, more fluorescent. So we spent a lot of time trying to figure out what to use to do that. And there were staining materials and different materials that we would actually paint on the zirconia that would give us fluorescence. But I have to admit, I don't think this was correct. And it took me a lot of years to figure out that it wasn't correct. So whether you're using metal ceramic, zirconia, or lithium disilicate today, just making the entire surface highly fluorescent doesn't really make it better for you. The goal with the fluorescence is to kind of recreate what nature was. And if you remember the picture I just showed you, I'll show you more. The highest point of the fluorescence in nature was really more around those cervical thirds and into the body. It didn't really translate well towards the insides edges like you see here. So it was kind of a mistake. The other mistake that was made is manufacturer-wise. When we started making zirconia ceramics, we actually added a lot more fluorescence into the powder besides for changing the coefficients and other things that we did. And the reason that we did that was because we knew zirconia itself didn't have it, and we wanted to increase the fluorescence in the zirconia powders. And I would argue that was somewhat of a mistake too. So I'll give you examples of what I mean by that. When I was designing frameworks back in the day, and they're a lot different today than how I designed them, it was really about trying to create the proper shape and then figuring out how to actually create some sort of a fluorescence on the substructure. And for me, I took the concept of PFM and I would start with marginal materials and use my marginal materials by either cutting back or not cutting back the margin on zirconia. In this case, you can see I have two foil veneers next to it, which I also use fluorescent margin material, which by the way, was a mistake because in veneering world, teeth already have the fluorescence we need. I didn't need to incorporate more fluorescence in those marginal areas unless I was trying to block out some sort of a discoloration. So, and I'll show you that more as we go through our time together. But because we were unaware, then the next thing I would do is I would find my most fluorescent stains, and whether these were the internals or accents or whatever you were using, I wanted to find what was the most fluorescent of those. And I would take those fluorescent stains and sometimes add colors on and paint them all over my zirconia. Now today, a lot of you are probably thinking, well, this is not supposed to be a history lesson. I could do that with my liners, and you're right. And you could do it with liners and you could do it with margin materials. But I want you to understand where the concepts come from and why we're making all these little shifts and changes as we start to understand. Now, remember I said that the zirconia powders themselves might have had too much fluorescence in them in the earlier stages of some of the zirconia layering materials. And that became evident to me as I started looking at final cases. This is a case from, God, 15, 18 years ago. And I remember feeling like it still looked dead. No matter what I did, I wasn't getting the life that I wanted out of it. And when I would photograph it under fluorescent is when I really started to see it, because there was so much fluorescence in the powder and there was so much fluorescence on the coping that it basically becomes a reflective area, that any light that's actually hitting the teeth is just reflecting off from everywhere. And I'm not getting the light distribution that I would like to get, which is reflecting light, absorbing light, pushing light in different directions, but not everywhere. So I would argue that this was kind of a mistake in this concept. And it proved out to me case after case. And I started going back and looking at some of my older cases. And I won't bore you with all the details of this case, the functionality and the gingival work that we did, but I think you guys get the concept. So I've gone through this so many times that in the end, as we're kind of working our way through our cases, I'm thinking restoratively, and I'm thinking, how could I make them look as real as possible? And if I'm going to use feldspathic materials, or I'm going to use zirconia materials or old school metal ceramics, I'm still thinking of the same concept of how I work my way through the case. So in this case, it wound up being a combination of metal ceramics and feldspathic. There wasn't any zirconia on here. Even at the time, it was barely being used. We did all the posterior metal ceramics, and I went back and did most of the anterior as feldspathic. And I went through the same concepts of how do I manage the space and nice preparations and trying to layer and create all the things that I did. And I said, you know, I'm going to use a feldspathic, a zirconia-based porcelain for this, even though I'm doing veneers, because these are the newer porcelains. They're supposed to be better. And after I went through all the details that I was working through, and I thought the case looked okay, but it still had a little bit of that deadness to it. I couldn't really put my finger on where it was coming from. And realistically, although the case looked okay, if you really start to look at it under fluorescent lighting, you start to realize that there's so much fluorescent in the material that I'm actually doing a disservice by trying to get too much on the internal structures. Now, the good news for us is the materials have evolved, right? So if I'm using the VM9 today, or some of the new Lumex materials, there are fluorescence in them, but not as much as back in the early stages of when materials were being developed, because we've understand and worked our way through. The other key that I use fluorescence for, so that's one area. Second area for me is the other areas that I use fluorescence for is not just to create that internal structure and light reflection, but also to support or reflect or distract light from the areas that I don't want it to go to. And I'll give you a better example of that. This is Mark, and I did this case on Mark, oh God, probably 15 years ago. And I remember the case kind of well because it was with a doctor that I worked with for a long time who's since retired. And I remember going through the stages of the case, and Mark was really a big personality. We talked about the crown lengthening and where we'd like the teeth to be, and he had one crown on the number 9 already. So that would be the challenge, because we'd have an aggressive amount of space on one tooth and minimal amounts of space on other teeth. So we were kind of trying to work our way through the whole process. And it's funny looking back at these photos, because the old model work that we used to do, that the Zeiser system and different things that were actually good systems, but the concept didn't change. What was I looking to do? Fill space. How do I fill that space? From the tip of the prep to the incisal edge, how much room do I have? And what color is the prep shade that I'm working with? And what kind of light optics do I really want to happen? So whether it was PFM or zirconia or lithium silicate, it didn't matter. The concept was still the same to me. So this was a technique I used to do more back in the day, where I would duplicate the provisionals into wax. And you can see I've done that here. And then I would take off 2 of the teeth and just work maybe 2 or 4 teeth at a time. And the real reason I did this was because when I was trying to learn how to mask certain teeth and not mask other teeth, I wanted to kind of have an individual understanding and not try to build everything up all at one time. So what you'll notice here is on these 2 refractory dies, you're going to notice there's a bluish reddish mark there on the cervical area of that die. And I put that there for a reason, because I was going to use some feldspathic marginal material to try to mask that out. So I wanted to basically put that material here, and after I put the material here, I fired it, I wanted to mask that area. And the reason I wanted to mask that area was because the prep shade was so dark. So creating this fluorescent light interaction was really important to me to be able to make that work and make fluorescence be my friend at this point to do that. And I worked my way through my normal case after I had my marginal materials. And again, the goal was to mask out that dark, discolored preparation. And then everything after that was kind of normal. I didn't need more fluorescence because the tooth had it itself. So I just went straight to my opacious dentin, my dentin materials. This was probably the early stages of me creating what I call the canvas concept today, and then shape and form. And you'll notice I finished those 2 centrals on their own, and I did not finish the other restorations at this point. And then I divested my 2 restorations from those models. And after they were done and they were acceptable, and I'll show you what I mean by acceptable, then I could start working my way through the rest of the case. And that was the laterals and the cuspids and so forth. Now, what did I mean by acceptable? Acceptable to me meant was, did I do the job that I set out to do? And that job for me was actually to mask this ugly prep shade. And I think this is an A16, if I'm not mistaken. It's all the way down the other end of the old classic guide. So what did I do? I took my cast and I actually put black magic marker around the gingival area of that tooth. And then I filled my restoration with a little bit of a glazing paste so that I can get an adaptation to it when I put it on the cast. And then I wanted to see that I was blocking out that black magic marker. And it worked really well. And once I felt like I had that, then the rest of the case was easy. Then I didn't mind completing the laterals and the cuspids and so forth down. So it's interesting what you could do. And don't forget there's black magic marker underneath the number 9, not underneath the number 8. And let's be honest, black magic marker is way more difficult to mask than that brownish kind of color that you're seeing in the natural tooth. So this was really helpful for me to kind of work my way through and understand what we could and couldn't do. You can see it even in the mouth that we start to, this is on insertion, so the tissue's a little beat up, but the goal of it is correct, right? The goal of it is where I can actually start to utilize my fluorescence to mask something, or utilize my fluorescence to now take up for the effects that I needed to do with pushing my light and manipulating light in the directions I want. And I remember we were kind of rushing this case through because Mark was getting married. So this is Mark and his wedding day and his bachelor party night, and kind of all worked out pretty well. His gums were still a little beat up when we inserted. This is on insertion, so the gums hadn't healed up completely yet. He was running off to get married, I think down in North and South Carolina, if I remember correctly. But you get the point, right? So the masking worked out fairly well, where the color preparation that was here was fine, and here was much darker, and yet we got a pretty similar. I think the hue is value's a little off, but not horrible, right? So it worked. We gave Mark kind of the right set of looking teeth for him. They were a little more rigorous, a little more rugged, and not so, embrace your space and roundy kind of look for his face. The second area that I really started to incorporate more fluorescence was once I realized it can mask things the way I wanted it to, I also wanted to utilize it to lengthen things. And this was kind of a great example. So it was a young kid who was in some sort of an accident. He was an actor, and I think he got hit in the face with a chair during a rehearsal. And what you'll notice is we've done really no work to the teeth, meaning that the teeth have a lot of space that we have to fill. And how would you fill that if you're just adding onto the tooth? And I think our first brain concept is opacious dentin. I'm going to put opacious dentin there, and opacious dentin is going to fill it. But if you've taken any of my other courses where I talk about the science of the materials and the opacity, you should know that opacious dentin at 3, 4, 5/10 of a millimeter is not that opaque. It really doesn't have the opacity we really need to actually create a blocking or something that's going to stop light from penetrating all the way through. So the right way to do that would be to incorporate some sort of maybe more than just opacious. And the way I did that was by taking my opacious materials and adding fluorescent materials to them. And back then it was my internal number 9, I think it was, which is the most fluorescent. But today there's so many more fluorescent type stains. And the beauty of that was by adding a little bit of fluorescence into my opacious dentin, it actually changed the optics of light. And I needed to do that because if you really understand how thin that opacious material is going to be, the opacious material on its own will not do what we needed to do, right? It really needed something that would kind of mask and block light. So mixing that in became my staple for how I can utilize that material or that fluorescent material differently. Now, I know that might sound a little contradiction, right? Because I said I don't really want the fluorescence all the way up towards the incisal edge, and I don't. But I'm going to go back one slide. Notice where my fluorescence really is. It's not all the way up to the incisal edge. It's just helping me mask the space that I wanted to mask. And it's also very deep inside, meaning that it's thin enough that now I'm going to cover it with my dentins and enamels and get back to all the other things that I wanted to create with translucencies and opalescence. So look what happens in the light. And I think you already know that these teeth are broken in 2 completely different positions. But notice how the light interaction works so well together, that even in the tooth that has a prep halfway up it to the tooth that has a prep almost, just 25% of it, the optics look the same. And the reason they look the same is because how I manage the internal aspects of light. And this is why, again, understanding how to use fluorescence is so much more important than me just telling you, oh, put some liner on your zirconia copings and you're going to be okay. No, it doesn't really work that way. The goal of this is really to think. And it's funny, I just wrote an article for the magazine that'll be out next month, I think, that's called When, Where, and Why. And the point of it was, I want you to be able to think through your choices, not just do them because it's what everybody else has done before you. And think through your choices. This is why I'm kind of giving you the history of how I've thought through them and how I've changed how I build and the interaction of all the materials that I'm using over a period of time. So I think that we've done some of the legwork for you, but I still want you to think, because if you just take the information and apply it without the thinking process, you're not really evolving into the plan of where you'd like to be from a technician point of view or a clinical point of view. So that evolution, I think, becomes really important for me to kind of work my way through the process. Okay, so you've seen 2 or 3 different areas. I told you the flaws that we started with first using zirconia. I've told you how I started incorporating it into margin materials more, and then even extending the tips of my copings and substructures or the tips of preps when I needed it to. And then obviously into frame design. And I've done the same thing over and over, so I won't bore you with the same type of cases. A completely different case with the exact same scenario. I want to incorporate my fluorescence here in this area that you see right here. This is the area that's going to be really, really important for me. And then once I do that, I can actually, in this case, I think I use what, EC1 with 5% internal, 01. It was 01, not 9, sorry. I get the numbers confused on them sometimes. I think in the old creation kit was number 9, and then the internal kit is 01, so I get them confused. EC1 is an opacious dentin in the VM9 kit or the VM13 kit, and I can actually utilize by adding in a small percentage of internal, and that gives me that little extra fluorescence, and do the exact same thing that I just showed you on the case before. So that case was 15 years ago, this case was maybe 8 years ago. That concept hasn't changed for me. I'm still utilizing materials that way because I know it works that way. I've seen it when I started doing it, and I see it today, that the more I do it, it really works really well for giving me the optics of light that I need. And it's the same process kind of over and over from that perspective. The other aspect was more in the clinical side. Well, now I wanted to say, okay, I can mask margins, I can get some fluorescence or some light transformation into the tissue, but I'm still feeling like I'm not getting the results I want from a final aesthetic point of view, that depth, that triad of a little bit of fluorescence inside and some opalescence and translucencies on the outside. So I walk through my cases always the same way. I'm looking at the face, I'm deciding where the incisor ledge should be, that hasn't changed. And then I'm looking at the old restorations and saying, okay, well, we're going to want to lengthen this teeth, maybe some crown lengthening here. And those are all the standard case diagnostic processes. But in the end, what do I want in my restorative? Whether it's metal ceramic, zirconia, or lithium disilicate, and you guys can guess and tell me which one this is, I want the same effect. So what do I mean by that? Let me blow this up so you can see it up closer. I want my chroma and light transmission into my gingival to look healthy. I want the values in that middle third of the tooth to pop up a little bit, and then I want to incorporate some translucencies and surface topography and all the little details that I would normally do in a restoration. And the goal of that is I should be able to do that in any restoration that I'm working in. I don't care if it's zirconia, lithium disilicate, or metal ceramics. I want the same thing. And I'll leave you guys wondering which this is. I'm sure some of you can guess, but the goal is I don't want you to be able to. Right? I really want you to be able to just say they look kind of real, and that's kind of what makes them look right. And in his lip dynamic, because he didn't show that much, or at least he didn't show enough of the upper, my goal was just to make sure that when you saw the tooth in the face, that they actually worked proper and had the right optics for us to look real. And all that is from what went into the inside. And I'm honestly telling you, it shouldn't matter if the coping behind it was zirconia or metal or lithium disilicate. The concept for me is the same. How do I create what I need internally and then layer on top of it like I normally would? So in this particular case, figure out what material it was. I think you guys should be able to tell. So here's how it's evolved for me today. With zirconia in general, and I'll use zirconia since Jim made it specific about zirconia, I've gone back to more old school techniques. And the technique for me is kind of more of this. When I look at nature, you'll always notice that this chroma in the cervical, value in that middle third, and that incisor ledge effect is really based on the age of the tooth. And that is standard. I've been teaching it that way forever. When you look at zirconia, I could design it in many different ways today, whether you're using lingual supported zirconia or creating some sort of a structure or mamelons, because the zirconias are much better than they used to be. This is the ST. This is actually a VITA zirconia. One of the things I've gone backwards on is rather than bringing zirconia all the way down to the margin, I'm actually cutting it back again. And now I'm using my fluorescent marginal materials to seal off that marginal area, create some fluorescence and some light transmission into the actual tooth, and to help me get the reflection that I needed to get light up into the root of the tooth. So I'm doing it the same way. I'm just taking it to an extreme level. So where most people that I know today, and I've probably said this before in other lectures, but I'll repeat it because I think it's important. When I'm teaching and I'm doing courses, I always ask people, what is their zirconia technique? And they always have one. It's always that they're taking their zirconia and they're painting either a dentin on it or something else on it, and they're firing it very high. And that high temperature, they were told, gives you a better bond to the zirconia. And I hear these same things over and over again. And I'm like, that's really just goofy. It's not necessarily true. Doesn't give you a better bond because you raise the temperature. And in truth, if that is really true, then the overfired ceramic that is now on the coping, how does that bond to the different fired ceramic? Does that give you a better bond? Right, so we can kind of analyze this and say some of the things that we've learned are just kind of goofy over the years. So I've taken it to a little bit of a different extreme. For one, instead of using liners, which I could, I go straight to my marginal materials. And the marginal materials are key. I think in the new Lumix material, there's a material called Power Wash. It's going to kind of really be a marginal material with a fancier name, right? But really what I'm doing is I'm using my one marginal material for the chroma that I want in that cervical third. I'm using a second marginal material to brighten and up and down the line angles, and maybe a little bit in the middle third to get that higher value. And then I'm not using a marginal material here, even though this looks like it might be because it's all during the same bake. This is not a marginal material. This is actually a normal material with a little bit of a blue stain in it. And I'm using that because the goal is I want to create that effect that I'm getting that more bluish gray against my lingual zirconia, which is thick at this point, and I'm not going to get the same optics that I wanted. So I'm really just using the blue-gray stain mixed with a little bit of a dentin, really just to create that bluish gray look. And yes, I know it's a slight contradiction because now I'm over-firing that material, just the blue-gray part I'm talking about, but I'm okay with that. So all I'm really looking to do at this moment is create that kind of a look where I have everything I want. And what is that? Let me blow this up so you can see a little bit better. So that chroma, that value, and then that bluish gray kind of effect. And I'm doing that almost all the time on my zirconia restorations. And it really hasn't changed from that. It's kind of what, I should say it has changed. That's kind of what I've gone back to. And the only thing that I'm doing slightly different now when I'm treating my zirconia restorations is I'm not extending the tip of them the way I used to. I'm using my ceramic marginal material on the cervical third, a brighter material in here, and then I'm just kind of bringing up a little finger-like structure there. So I can actually kind of create what I needed to do, give me that internal fluorescence, and then I'll go back to my normal opacious materials to extend the tip of the coping if I need it. Again, if it was a huge amount of space, I might consider using the fluorescent material. But when it's a normal coping and a normal 1.5, 2 millimeters, I don't need it. I don't want that extra fluorescence there. So for me, this is kind of how I work with almost all my zirconias at this point. And this is kind of one of my favorite photographs because I think I always say from a ceramic point of view, if you're a ceramist and your case is in front of you and you have a brush in your hand ready to pick up and you see this as your starting point, you should feel excited because I know I do. When I see this, all I'm thinking about is I can't wait to build this because everything I need is right here. And now it's about me just adding to it and being artistic and creative. And that's really the goal with all these materials that we're working with. So that heavy fluorescence in this area is all I want. And then the rest of it I'm managing as a per case basis, a little different for each case. And I think in today's time, it's kind of the norm, right? So as I'm going through these cases, sometimes I'm using zirconia, sometimes I'm using metal ceramic, sometimes I'm using feldspathic, sometimes I'm using lithium silicates and disilicates. But it doesn't change my concept, and I still have to manage the space that I'm working in, utilize some fluorescent materials to either help hide, mask, or distract, and then create some sort of a fluorescence inside to make it look similar to what the natural teeth look like. So I'll walk you through this case a little bit. And the reason I just put this case in there was kind of last minute was because we're going to utilize two different materials here. I'm going to utilize zirconia because we're not placing an implant. I'm going to have a 2-unit zirconia bridge here, which I'm going to need to incorporate some fluorescence on. And I'm going to have natural teeth here that are going to be all veneered with feldspathic or the same feldspathic material that I'm going to use on the zirconia material. So I have two different materials here, and I have to think through the case. Additive wax up, which is how we normally work these cases. That wax up will get transferred for the doctor to place in the patient's mouth and evaluate the incisal edge position, just like we normally would, and the shapes and forms. He had a little deficiency here that we really wanted to do a little bone graft and gum graft, tissue graft, but the patient didn't want to go through it or pay for the extra, I guess you could say. But in the end, we're going to try to stay as minimally invasive as we can. The implant was in place, and my doctor, this is Dr. Bernadette, was actually going to do the ABT technique where you actually prep through the restorations or the additive evaluation a little bit more, so we don't have to over reduce the teeth. We're just giving enough space for the new materials. And obviously she only has to worry about that, or our doctor only has to worry about that for the veneers. Here we're going to be more of a 360 full coverage and a cantilever. So for that area, it's going to be a normal preparation. Okay, so that's the APT technique, kind of made famous by Garib Karel back in the day. For those of you, if I'm going too fast and you don't know what that is, it's basically where you do a diagnostic wax up, take that wax up and place it in the patient's mouth, and then prep through the wax up if you like the aesthetics. This way you're not reducing too much of the tooth, you're really just reducing what you need to give the proper support for the final restorations, okay? So I worked this through as a combination alveolar cast for the refractory veneers. Then you'll see a 2-unit frame with a little bit of an ovate pontic site here for the 2-unit restoration. So just like I said before, I don't really need to create fluorescence here at all. I don't really need it. Do I want to extend the tip of these? I can. Can I use fluorescent material for that? Sure, I can. I could go either way, to be honest with you. If it was a big distance, if I was adding 2, 3, 4 millimeters, 100%, it's going to be a fluorescent material for me. If I'm adding 1, 1.5 millimeters, I kind of don't really need the fluorescent material, and the opacious materials are really acceptable. But because I'm working this case at the same time, and I have to manage the fluorescence of the zirconia and that transition between what this tooth is going to look like in the final and what that tooth is going to look like in the final, I am thinking about the challenge of the materials and adding the fluorescence. So I want to create my canvas, and I want to do that by exactly what I just said. I'm going to use some fluorescent materials here to get some warmth in the cervical, some brightness, and get that tip up into the middle third of the tooth to give me that warmth of fluorescence. And because I did it there, I then very thinly did it on the other teeth. Not that I needed much fluorescence because they have it on their own. So I just applied it very thin so they had a similar light optic when I layered my dentin materials over it later on. And then I went straight to my dentin materials. Let me also backtrack and be clear to you guys that my marginal materials and my liner materials both fire at higher temperatures than your normal dentin materials. So another reason I like using them is because I fire them first. They create stability, meaning that they won't change during the next bake. And then my next bakes are less because I don't need as much dentins and as much effects to get the values that I need, because it's all established by either the marginal material or a liner. And the reason I say by either is simply because I can do exactly what I'm showing you with margin materials or with liner materials. Liner materials have a very similar effect. The flaw to it for us is we think of a liner as a material that was supposed to paint on the coping very thin and fire it. And it's supposed to give it some fluorescence and color. I'd make the argument that what if you utilize that liner material just like you would an opaque dentin material or a margin material. Building it a little thicker, using it to finish off a margin, using it to lengthen the tip of a crown, you're going to get more space filled with more fluorescent type material, and you're going to have more stability for the second and third firing, which we now will not need as much dentin material. So for me, I would say liner and margins are kind of mixable. You could use either or. I honestly choose to use margins more. And the reason I choose to use them more is because optically, I feel like the particle size of the margin materials are slightly larger, and I think the reflectance of them are a little bit better. The liner materials are highly fluorescent, and the particle sizes are slightly more dense, or more small, I should say. And that's because they were really made to be used as washing materials. So building them up in thickness is actually fine, but I think if I'm really scrutinizing it, I almost feel like the margins are better. The reason I'm kind of harping on this issue is because a lot of the times I'm in a lab and I ask them to have a margin material, and they're kind of like, no, we don't use margin materials. Like, all right, do you have a liner? Yeah, we have the liners. Okay, let's use the liners. The liners work just fine. I'm partial to the margins, but the liners are just fine if that's what you already have. Okay, so after that, the same build-up process that we normally do. I create my canvas, chroma value, mammalian materials. By the way, your mammalian materials also usually have small amounts of fluorescence in them. So they can also be used for extending the tip of a crown. They could be used for mixing into a dentin if you wanted to create more fluorescence, especially if you're using maybe VM9 or one of the older ceramics. The newer ceramics have fluorescent dentins like the Lumex and some of the other new kits on the market where there's actually flow dentins, and those dentins have a little bit more fluorescence to them, okay? But your mammalian materials do. So after that, I'm going to go into whatever contrasting effects I want, maybe brightening up that middle third of the tooth, and then I'm going to start filtering the tooth with my enamels like I normally would. How much translucency do I want? How much opacity do I want in my filter or in my enamel, as I would say? Because again, I think of the enamel always as a filtration system. And remember, what is it filtering? My dentin and my substructure, which has fluorescence somewhere on it, for me to get the optics and the light that I really am looking for. So again, the same process over and over again, won't matter the material, and that's why I put this case in at the end, because I'm using feldspathic ceramics on veneers and the same feldspathic zirconia ceramic on the 10 and 11 on zirconia. Okay, so I'll finalize the restorations. I think you should notice even on the cast how thin those veneers are. You can see the stone popping through. But even on the cast, notice how they don't look that much different than the optically from the zirconia restorations. And again, I have two solid structures here, and then these are all veneers that we're working through. And in the end, we'll place those in the patient's mouth. And if you look contralateral from lateral to lateral, I think you can see, even though I'm not happy with the tissue there, but from a density point of view, not bad. We're not that far off of how those blend in together. And that's really the goal for us, right? Is to kind of make these work and blend together across the arch. Sorry about the photograph. It's a ring flash, not a proper flash, but you get the idea. So I think I'm just about on time, or maybe a few minutes early there, Jim, for a change, but that's actually probably good for our first one back. With that said, I'll say, Jim, thanks for picking difficult topics and making me rework them so often, right? Because I had picked this topic last year. I think we did it sometime in, I don't know, August or September or something, but I actually went back and went through the lecture, and I was like, all right, I gotta give Jim a different twist on it. So hopefully that was a better version for you guys. And I appreciate you popping in. I really hope to see everybody in Chicago. I could tell you that I'm in the works with 5 or 6 cases that I'm hoping to have finished up and talk about in Chicago. And 1 or 2 of them are really interesting, with some masking and discolorations on the preps and use of different materials. So I hope to see you guys all in Chicago. But with that, I'll say thanks. And Jim, if there's any questions out there, let's go through them. Thank you, Jim.
All right. No, thanks, Peter. Appreciate it. And looking forward for Chicago as well. it'll be a great time there. We've got a great lineup, including yourself, to lecture during the LMT Chicago time. As far as the topic goes, I think what's more important is the questions we have. Sometimes it surrounds a central theme, but not necessarily specific. So what you do great is that you work from kind of the theme topic, but kind of outward or inward, however you want to look at it, to bring along what we have to think about when we try to think about, when we think fluorescence, what does that really mean, and how do we duplicate it? So I appreciate it.
Yeah, exactly. That's the point, right? I think it's easy to tell people, oh, you need fluorescence on zirconia because it doesn't have it. Okay, well, what does that really mean if you don't understand?
What does it mean? Yeah, exactly. For sure. All right, so I'm just going to finish up a little bit here, show my screen. Get this range. All right.
Okay.
All right, so as we mentioned, you will also receive an email from us from marketing that will talk about CE. So those of you who had questions on CE, that'll be taken care of through the registration that you have. The webinar was recorded, is being recorded, so as soon as it gets buttoned up, and we will load it in a day or two. And again, as I mentioned, it'll be posted on that VITA North America Learning channel. This is just information if you want to get hold of one of the reps, have questions as well. Peter graciously shared his information, contact information as well. This is a help desk if you have questions here direct to us. We do have other webinars with Peter and others throughout the year, so this is just a partial lineup, so please visit us and join us again. And of course, Peter shared with his information already, but we'll leave it at that. So questions and answers. Let me look and see here. We got a couple questions. Let me pull them up and get going. All right. Are you doing a wash bake on refractory dyes using clear ceramics, and what temperature? I guess it depends on the material and all that. So
yeah, so I guess calling it a wash bake might be confusing. So let me kind of define it differently. Most of the time when you're using refractory dyes, which I still use, you're really supposed to put some sort of a sealant or something on the dye to kind of keep it sealed and then build your ceramic from it. I use several different materials over the years. Today I've gone backwards again, and that's because the refractory materials have changed. I'm actually using the Shera refractory material now, and I find that material didn't work the same way it worked when I was using the GC material. So simple answer to your question is yes. Now I'm using some sort of a wash bake. In this case, I would take window ceramic, just kind of cover the whole dye lightly, and I do fire that at slightly higher temperature. I'm usually about, I think 920 or 915, just to get that initial bond into the zirconia, and then I'm building my ceramic from there after. So that's become my standard with refractory.
All right, and then whenever we talk about fluorescence, we always get this question. So any particular wavelength black light you use to check the fluorescence?
I don't. I'm probably not smart enough to tell you. I mean, I could tell you the nano light gets to, I think, 420 before it really starts to, that you can't see it anymore, if I remember the scale properly. But in truth, any true fluorescent light works. You can buy them at your local hobby stores or online today. The ones that don't work very well are some of the flashlights that are just violet lights. I'm assuming their temperature is probably in the lower 300s or something, and they don't really create fluorescence. They just make it look kind of purpley at the end. So a true fluorescent light you can get with a true fluorescent bulb at any of the stores, and I think I ordered them online today. Also, I have a camera today that I could take mine's actually down now, so I was trying to shoot a few pictures yesterday, and my camera wasn't working, and I called my friend Sasha. I'm like, Sasha, help my Sasha Hein, who sells it. My fluorescence not working. Help me with my settings. So I'm waiting for him to get back to me. But I have something called Fluorize now. It's like polarized that I can actually put on my camera, and I don't have to be in a dark room with fluorescent lights anymore. It really gives you a lot more better detail, although it's been down for the last few days. So I'll hopefully have it fixed in time for all the photos I'm taking for Chicago right now.
And actually, that was one of the follow-up questions. Do you use the Fluorize filter? So
I do.
Sounds like you do.
The settings are off at this moment, and I've been playing with it for a week trying to fix them, and I'm not sure. So I gave it, and I called my friend. I'm like, help, because I'm not sure why something's not right on it again.
Did you mix margin material with the fluorescence to apply to the incisal area?
No, so I didn't mix any fluorescence in the margin materials, because margin materials already have their own fluorescence. So I don't need to do that. I think what you're asking is, when I showed you the cases where I extended the tip of the crowns, did I use marginal material for that? No, I used opacious dentin materials or effect dentins like EC. I call them opacious dentins. In the VM kits, they're effect chromas or chroma pluses, but they're basically opacious dentin materials. And when I'm using those opacious dentin materials, they won't have enough opacity to stop the light. So I'm adding in a little bit of the O1 internal fluorescent stain into the material to help change the opacity of the material. The margin material already has fluorescence in, so I don't ever need to add anything into it.
All right. On the case that you had the margins, you were talking about cutting back the zirconia, like an old PFM shoulder. Have you ever had any flaking of the margins?
No.
It bakes successfully, correct?
Say no, I never have. I think margin materials are really stable. I mean, it's such a great material that I think we don't utilize enough of. And to be honest with you, when I was starting to use zirconia in the beginning, 6, 7, 8, 2000s, I was doing it with 360 margins, right? Just like I was with PFM. I got away from it for a period of time because I thought I didn't need to do it anymore. The zirconias are more translucent today. They're better grades. They have so much more to it. And then as years went on, I would look at my cases. I would see that something wasn't right, the way the tissue was interacting. And I kind of maybe 2, 3 years ago, I started going back to cutting away the margins. I'm not cutting them away 360. I'm kind of doing 180s, and it works fine with zirconia. For metal ceramics, I'd say 360 is better. But with zirconia, I think 180 is fine. And I almost enjoy the aspect of it, because here's what I would say. What you consider a wash bake, I consider my margin bake. The difference is you painted on a very thin color on a coping that probably didn't do much of anything for you. I built a margin on my coping in my middle third that did a ton for me. And I feel like it's just a way better starting spot. And let's be honest, how long does it take for you to actually build up a margin, put a little material on the middle third of the crown, fire it, and you're done? I mean, it's like a minute buildup, right? And that minute buildup now makes the rest of my building so much easier.
All right. Well, Peter, thank you again for a tremendous webinar. A lot of knowledge. I always appreciate you coming on and giving your wealth of information to everybody in the real life situation. So greatly appreciate it. Any last minute partings for the audience?
Forward to Chicago. I haven't been in Chicago in 2 years, which is crazy since I was there 15 straight years in a row. So kind of looking forward to being back and doing some things and seeing some people and some cases that I'm working on now that I'm kind of looking forward to presenting. So hopefully I'll have them all done in time and be able to utilize them all on a Friday and Saturday.
More work.
Yeah.
It never ends.
Thank you.
Well, thank you, Peter. I want to thank the audience, everyone that joined us. Again, appreciate you coming online, spending an hour with us. Please look forward to seeing you again in a future webinar. So right now, this will end and conclude today's webinar. Thank you, everyone. Have a good day wherever you may be.
Take care, everybody.